Hi, we will discuss now a very important topic, which is the anatomy of the brachial plexus. As most of us know, that it arises from C5, C6, C7, C8, and T1. In some cases, it can have some contribution from C4. In that case, it is called prefixed, or could have contribution from T2, and in that case, it's called postfixed. C5 and C6 rods join each other's. C8 and T1 rods join each other's, while C7 stays on its own. Again, C5, C6, they join each other's, while C8 and T1, they stay on their own. Now, C5 and 6 and C7 on its own, C8 and T1, they make the trunks. This is the upper middle and lower trunk. This area is called the trunks. Each and every trunk, they further divide into anterior and posterior, anterior and posterior, anterior and posterior division. The two anterior divisions from the upper and middle, they form a cord called lateral cord, while the all posterior divisions of the three trunks join and form posterior cord, and the anterior division of the lower trunk form the medial cord. I'm going to use a different color to make this a bit simpler. So, again, the trunks divided into anterior and posterior division. The two anterior divisions of the upper and middle, they joined together to make the lateral cord. The anterior division of the lower trunk, it moves on its own to form the medial cord, while the posterior divisions of all the trunks, they join together and they make the posterior cord. Right. as simple as that. We will start discussing or talking about the branches. First branch comes from C5, and in the drawing here you can see it is moving backward, and from backward we can remember that this is a posterior, and since this is very proximal in the beginning or the origin of the brachial plexus, so it's so close to the scapula, so this is a posterior scapular nerve. Another branch coming from the root again. When I start drawing it, I'm quite sure most of us will remember it. It comes from C5 and C6 and also C7. It's quite long, and it is called long thoracic nerve. This goes to serratus. This goes to serratus muscle. And sometimes it is injured during lymph node dissections following a mastectomy, causing winging of scapula. Then we come to nerves from the trunks. We have only branches from the upper trunk, which is nerve 2 subclavius and suprascapular nerve. Again, let's repeat this again. From the roots, C5 and 6 joins C7 and make the long thoracic nerve, but C5 gives posterior scapular nerve on its own. Then we move on to the trunks. Only the upper trunk gives the nerve to subclavius and suprascapular nerve. From its name, nerve to subclavius is to subclavius, and suprascapular nerve to supraspinatus and infraspinatus muscle. We move on to the cords. Right. Lateral cord. Lateral starts with an L, right? So we have an L, L, M, which is lateral pectoral nerve, lateral head of median nerve, and muscular cutaneous. Yeah? We'll move to the medial cord first, and since it starts with an M, yes, that is right, then we have an M, 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 U, M like mum. And it will be the medial. Pectoral. So we have a lateral pectoral and we have a medial pectoral nerve, followed by medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. Then U. What is the U? Ulnar nerve. Then the final M is the medial head of median nerve. Final chord we remember this one by the word ultra. UL for the upper and lower subscapular nerve. We had a suprascapular nerve here. We have a subscapular nerve here. T is for the thoracodorsal nerve. R is for radial and A for the axillary nerve.